It's only natural for us to want to know, is it more contagious? Is it more deadly? Will the vaccine be as effective? But those questions are really hard to answer, and they're answered through really rigorous research. And right now we're at step one. Step one is just identifying the variant. This particular variant does have a mutation that is related to what we call the spike protein, which is something that the virus uses to attach and infect cells. And the spike protein is also something that current vaccines and antibody drugs target. So there is always the concern when we see a spike protein mutation that could in some way help the virus escape from drugs or our immune system or vaccines. Viruses develop mutations when they infect new cells and when they replicate. So if we want to limit the opportunity for them to continue mutating and spreading, we just have to kind of stick with the same public health measures we've been doing. Anything that we can think of that we know helps reduce the spread of coronavirus, regardless of what the variant it might be, will help us avoid developing more of them. I think we've been in some ways a little spoiled with the COVID-19 vaccines because the efficacy rate was so high right from the beginning. These are very demonstrably good vaccines for COVID-19, and we don't have any evidence that they're anything but effective, even against the variants. It's understandable that we woke up today in a panic because the UK variant started like this, others have started like this, but we really won't know the answer to these questions for a while. And people, if they're concerned about variants, really what they should do is just continue to do what they've been doing this whole time, if they want to help curb the spread and reduce. What they essentially did was they looked at this database called GISAID, which is this big global database of viral genomes. And they essentially developed a software to try to detect clusters of variants, right? So to see, are there any places where we're seeing a new variation of COVID-19 that we should flag? And that's how they found this New York variant. They were noticing that this particular set of mutations was happening with increasing frequency in New York, around the city and in the region. When they looked at the samples taken from New York and uploaded to this database in February, so that's the sample set, the variant was present in 1 in 4 of those samples. So, again, those are caveats, right? This is only sequences that were uploaded to this particular database. We're talking about 1 in 4 having this mutation in February. The author of that paper has said this variant seems to have also been found or have spread in New Jersey and Connecticut and has some isolated appearances across the country. But for now, it seems really kind of clustered in New York. The second paper, which came out today from Columbia University, what they did was way more targeted. So they looked at samples of COVID-19 patients at Columbia's Medical Center from November 2020 to February of this year. Both of these papers are what we call preprints. That means that they have not been peer-reviewed and they don't appear in scientific journals. So this is really the beginning of the scientific peer review process, and so we have to keep that in mind when we're talking about these papers.